guys, so today I want to talk to you guys about the COVID-19 or the coronavirus and just share some of my experience and knowledge regarding this current illness, and we'll see. If you have any questions, don't forget to go to the previous post and ask me anything regarding the COVID-19. Only the COVID-19, don't go and ask me some weird creepy things. Someone just asked me how to lose weight, and I think that's just dumb to ask me of all person how to lose weight, because I haven't been losing any weight for the past God knows how many years. So what actually is the coronavirus, right? Actually, a lot of people are very concerned when they hear the word coronavirus, but it's actually one of the viruses that causes like flu-like symptoms, very mild among the human population, which are fever, cough, flu, body aches, and this kind of sore throat and these kind of things. But ever so often, this virus actually mutates and become a deadlier strain that causes these kind of outbreaks. Like in 2003, we had the SARS. About 8,000 people got infected and 10% of them died. And in 2012 up to even 2019, there are still cases of the Middle Eastern Respiratory Syndrome, or the MERS-CoV, which infected about 2,500, of which 35% of them died. So if you actually look at pure numbers, right, percentage, the SARS as well as MERS is much higher than COVID-19. So a lot of people use this worldwide is much higher. And then there's this fear because the disease is still very young, only 2 months compared to SARS, which has like 6 months, 9 months, and MERS, which was like for 7 years. It's a very new disease, but just in 2 months, an excuse, right, that the COVID-19 is not as deadly. Well, it is true. The mortality rate is much lower. COVID-19 is recorded at about 3.6 right now, but the infectability and transmissibility was 160,000 people has been infected with over 5,000 deaths. And this is in spite of the great efforts put on by the people from Wuhan and worldwide with their regular screening, with their aggressive contact tracing, and all these banning flags, quarantering off people, self-quarantine, and all those. In spite of that, the numbers are still so big. So it's definitely something that's going to be very concerning. So the transmission is said to be close contact, and it is actually defined, right, by being about at least 2 meters away from an infected person for a duration of at least 2 hours. Some even said it's up to 6 hours of less than 6 feet away, 2 meters away. But it does not mean that if you are in positive contact with someone and left for less than, like, let's say 30 minutes or something, you will not get a disease. You probably still can, but the rate is much lower. But you are at high risk if you are in close contact. Again, the same definition, 2 meters for 2 hours in an enclosed area with a positive. So one of the most common questions I got asked is, do I actually have coronavirus, or how do I know you have coronavirus? Well, the symptoms are very general. It's overlapping with every other single flu-causing viruses, like influenza or anything else. So it is fever, cough, and breathlessness. These are the 3 main symptoms. But some people say, oh, sore throat, diarrhea, flu. It still can happen, but it is not the 3 main symptoms of the coronavirus. Body aches and all those are possible. But more important than all of those is actually, do you have a risk factor, right? Risk factors for this COVID-19 will be travel to high-risk places. And by high-risk places, it actually means places where there are a lot of sporadic cases that's going on. China, the European countries, South Korea, Iran, these are the 4 main high-risk places. COVID has spread to over 100 countries, but not all 100 countries are considered high risk. Because if you go to Thailand has only 50 cases, as compared to Malaysia, it's almost 500 cases today. And then if you travel to other places, I've recently just went to Laos with only 1 case reported. So it's not a high risk country, but does it still pose a risk? The risk will be there in anywhere you go, because, like, 1, not everyone is being checked. And 2, a lot of the people with this disease actually do not exhibit any symptoms, means they do not have fever, they do not have cough, or they do not have breathlessness, but they still can transmit the virus. But with that in saying, going to countries that are not extremely high risk, I think it is still safe as long as you practice a very good hygiene, you practice preventive measure, and you avoid crowded places. However, going to high risk countries, which are the 4 countries I named earlier, should really be discouraged at this point. Even more discouraged if you are going to the province or the area that actually has this disease. For an example, right, to say the entire China is infected is a little bit unfair, because there are certain areas that have very reported case, because China is so big. But like Hubei province, which is the main area where Wuhan is, where the majority 90% of the cases are from, yes, that is an area you do not want to go into. But of course, there are a lot of local travels and everything, so the risk will be definitely much higher as compared to going to a country that has very low reported cases. So let me repeat, if you have the symptoms of COVID-19, which are fever, cough, and breathlessness, alongside with risk factors, which are the close contact with a positive person, as well as recent travel to a high-risk country, which are China, Korea, Iran, and the European countries, then you should notify the health inspectors that is around you and health facilities around. So now, let's say you have the symptoms as well as the risk factor, either positive contact or travel history, whatever. But you have all of those and you're concerned like, oh, what if I have the coronavirus? What am I supposed to do? So this part is very important, because it is important that you play your role as a patient of or suspect of coronavirus. So pay attention, this part is quite good. The most important thing to do is not to just show up at a clinic or a hospital and be like, hey, I think I have the coronavirus because I just came back from Iran or Italy and I have all the symptoms of COVID-19. No, what you should do is actually call up the clinic or the hospital that you think is the most convenient for you and tell them you would like to screen for coronavirus because of these reasons, and they will put you in line to someone in charge, either the doctor or the nurse, and they will discuss and assess your case, because not all hospitals and clinics are equipped to handle a coronavirus. You will need a decontamination room, you will need negative pressure, you will need a powerful filtration system, and you need definitely the expertise to handle it. So if you go to the wrong place to screen, you are indirectly contact with a lot of other people. So the key point here is to minimize positive contacts as much as possible, because if you really suay kena the COVID and then you go and meet the person in the counter, you go and register yourself in the front counter, and then you got brought to the emergency and you wait for 30 minutes or 1 hour where there are other actual sick people there, and the nurses and the doctors and the cleaners and everyone else around you will have to be traced, and they potentially can get the disease from you. So call up the center, tell them your concerns regarding the coronavirus, and if they can accept your case, they will let you know. If they can't accept your case, they will direct you to the nearest hospital that has been equipped or designated as a coronavirus center, screening center. So that will cut short a lot of people, and you go straight to the point rather than, meeting a lot of people along the way and possibly infecting more people. So once you call up the hospital and they told you like, okay, you are suspicious of coronavirus and they would like to see you, what you should do is, if possible, you should go by your own transport. You should put on a mask and go straight to the hospital, to the emergency department or whichever area you were told to go, and not go hang around, go to the cafeteria first, go to the lobby, take a selfie or what. No, go straight to your area and reduce and minimize contacts. That is very important, and I think a lot of people are not sure what to do, so they just go around to random clinics, to random hospitals, and just I want to see a doctor, and later on only they reveal that, hey, I possibly have COVID-19 because I just came back from somewhere, right?